And thanks very much for inviting me to speak today and share with you some of the things that have been going on at Alder, which, as Liz says, is an absolutely fantastic institution. Great privilege to work with many colleagues there who are absolute leaders in their field in this country and internationally. And I guess the journey that we've been on over the last 6 years has been about saying, actually, what do we want Alder to be in the next century, and what do we want for children's healthcare in this country in the next century? Because Alder set out a very clear vision about 4 years ago to say that we absolutely wanted to be one of the leading providers of children's healthcare and research in the world. And what does that mean to do that? We've had a great challenge actually earlier on this morning from Ken, and thank you for that challenge, Ken. You quite rightly said the title of this presentation, The Art of the Possible, suggests that there might be limitations on what we're trying to do. You're quite right, it was a great challenge. Perhaps the title should have been The Art of the Impossible, because that's a little bit about what I want to talk about today. In other words, how do you achieve that vision and the ever-increasing demands on healthcare, the demands of children who I might tell you have no boundaries to their imagination, the demands that they have for how their care can be improved in the future. How have we done that in an environment with no money? As Liz said, we've been focused very much on thinking about what are the expectations and challenges for children's healthcare nationally in this country and internationally. And we hear a lot, quite rightly, in this country about the demands in our population of our ever-ageing population. And quite rightly, we're all very focused on that issue in the NHS. But sometimes we forget the other end of the spectrum. And one of the things that's happened in children's healthcare over the last 5-10 years, which has been a trajectory that the system's been on for a long time now. And it's partly in Liverpool due to the fact that we have a truly fantastic women's hospital in the city, coupled with an equally fantastic children's hospital, that we've been able to see amazing improvements in the longevity and life chances of very young infants. We now see infants at 22 weeks surviving into adulthood, and you certainly didn't see that even 10 years ago in this country. That brings enormous challenges with it, because many of those infants do have quite complex medical problems, and our job is to make their lives the very best they can be, so that they can be hugely productive members of our community in the future, and that's what we're all about. So what have we been doing? How have we been thinking about what it means to be one of the leading providers of healthcare and research for children and young people in the world? It's been about thinking exactly along the lines that Ian described earlier. It's been about thinking about what do children and young people really need and want? What are the limits of their imagination? What kind of environment do they expect to be treated in? And I'm not just talking about expectations, I'm talking about what kind of environment actually helps make them better. What technologies do our children and young people expect us to be communicating with them? Children and young people, as most people in this audience will, I'm sure, appreciate, are in a completely different space to the space that I occupied when I was their age, which is an awful long time ago, sadly. Their approach to technology is completely different to ours, and they expect us to operate in that world. It places huge demands on us. We simply cannot communicate with our children and young people and their families in the way that we need to if we carry on doing what we've always done. We need to have completely new ways of working in providing services. Children are best not seen in hospital by and large. They're better treated and looked after in their own homes. Hospitals are dangerous places. So by and large, they are much better if they are kept at home. So I've got a picture here of a wonderful new facility, which is going to be the new Alder Hay. And it has been built and designed with and by children and young people. Absolutely. It's their hospital. If we designed it, it wouldn't look like that, I can tell you that for free. Because it doesn't look like a hospital. And one of the things they said to us was, please don't build a hospital. They're scary places. We really actually would prefer not to come to a hospital at all. But when we do, please make it friendly and welcoming. And please make it suitable for what we want. So new ways of working that aren't necessarily inside a hospital. And innovative and absolutely world-class research that puts our services at the leading edge of services anywhere in the world. Ian talked about Liverpool's fantastic expertise around personalised medicines. And as part of Liverpool Health Partners, Alder Hay is working together with colleagues across the country to lead the Children's Network, and we have done this for about 6 years now, the Children's Network for Medicines in the UK. And recently, in partnership with the University of Liverpool, we've been designated as the lead centre for children's research in this country. So part of what we've been developing is the kind of hub that Ian just talked about that is going to focus on developing children's research here in Liverpool. But how do you do all that in a world with no money? How do you achieve all that? Well, as Ian said, you can't do it on your own. We knew we had no chance of meeting those demands on our own. We're a relatively small operator. Our turnover is around about £200 million a year. And the NHS doesn't make the kind of margins that enables you to invest huge sums of money to keep moving you forward and being at the cutting edge of technology, new ways of working, facilities, people, great people. So how do we do it? We started by thinking about who the strategic partners we needed to engage with. We recognised that we couldn't possibly meet those demands on our own, and we started to think about not just our NHS HEI partners, who are incredibly valuable to us and essential to everything we do, but we started to think about partners in industry, going back to Ian's diagram, because we recognised that we simply weren't working closely enough as an organisation with some of those partners to leverage the very best we could for our children. And we developed our first partnership a couple of years ago with BT, interestingly. British Telecom were very interested in partnering with an NHS organisation to think about how they could improve their own response to user demands. They've always been quite big in healthcare, but they've not really got into the hospital sector in a big way. But we went out to the market 2 years ago and just said to the marketplace in IT, would you be interested in partnering with Alder Hay? Because these are the sorts of things we want to do. And we had 4 responses to that. We had IBM, HP, BT and Tata. And frankly, we were quite astonished by that. But they were all interested in thinking about how they can work with the health service, with a hospital like Alder Hay, with a strong research base, to leverage technology to change the way we deliver healthcare. And BT actually came through that process, and we selected them as our preferred partner. And working with them, we decided to think about how can we create the kind of environment that really attracts other partners like BT to come and work with our brilliant clinicians at Alder Hay. Fantastic researchers, brilliant surgeons with great ideas. If I had £1 for every idea in my clinical community, I'd be a very rich woman. But I had no way of leveraging making those ideas a reality. So what we thought about was, how do we create an environment where we could bring these people together? Because there was clearly a desire out there in industry to connect with clinicians in the health service, and we don't do that very well. So we created what we called an innovation hub with BT. And some of the characters there are here today. We also recognised that if we were going to give our very, very busy, talented clinicians any chance of hooking up with industry, we needed to give them time. So we created time in their diaries to just think differently, to spend time with industry. And Ian Hennessy, who's one of the characters in here, was one of our brilliant surgeons who basically devotes half his job plan now to just thinking about how we innovate and partner with those who are thinking as we are. We have created facilities on site, and we've created a project management structure as well, which sounds really boring, but actually it's all very well having ideas, but if you don't put something behind them, they don't happen. And what we've been absolutely astonished by has been the response, frankly, to us just doing that. Because what we found is that all of a sudden, lots of people want to come and talk to us. And we were truly astonished by that. I guess I'm really talking to the health service colleagues here now. I was genuinely surprised by the response we've had. So what have we been up to just in the last couple of years working with these partners? We decided that we wanted to do some early wins, things that would tackle some of our issues quite early on, some of the issues our children and young people were saying to us. And I'm just going to give you a few examples of what those are. The very first one we set out on was around thinking about what we've called PETS, but basically it means patient experience and therapy services. But PETS is a good title for it because it does revolve around animals a little bit, because that's what children love, animals. But basically what this was saying, let's get a bunch of people together, which we all did. We all went to Everton, actually, and we got a whole bunch of people together. We got a whole gang of children, a whole gang of parents, BT, our staff, and we set out to think about what are the really important things for children. We sat and listened to them, and our colleagues in BT sat and listened to them. And this is what children said to us. Hospitals are scary places. We're really scared about coming into hospital. Could you please make it as easy as possible for us to understand what's going to happen before we come to you? Familiarisation. Parents really worried about the way we communicate, and we think we're good at it. They still worry about it. We do very scary things to children to make them better. It's quite hard to take in when you're a parent, and speaking as one who's been on the end of it, I can vouch for that. However brilliant the clinician is talking to you, it's very scary, and usually you're not listening to them at all, you're just frightened. So you sit and think about it, and then you go away and you think, I have no idea what that clinician said to me, actually. But I know my child needs a very serious operation, and I'm scared about that. Consent. Big issue in the health service. We need to make sure parents and families and children have really understood what we're saying to them. Acting on feedback. Please do that. Please provide support for me before, during, and after my episode at Alder Hay, whatever that is. Do I really have to come into Alder Hay for the therapies that I need? Do I really have to do that? Do you know, I'd really rather not. I'd rather have that at home if possible. Play is really important. Children get better if they feel good about themselves. And one of the things that helps them feel good about themselves is playing. And playing means different things to different children. Children this big and this big play differently, but they all play, and they all said it's really important to us. How can we do that? I can assure you it's quite difficult to do that in a building with no Wi-Fi technology, which is what we have at the moment at Alder Hey. So how do we create that kind of environment? Telehealth. This business about not being in hospital. We have many complex children with comorbidities, lots and lots of complex issues going on. They don't really need to come into our hospital all the time to get their drugs, to have their therapies. We can use technology to keep them safe at home. So we've been running pilots with them to say, okay, how do you keep safe in your house? How do you connect with our clinicians, with your consultant? Give him your vital signs, and we and you together can keep you on track. Because a lot of our children travel an awful long way to come to Alder Hey from all over the country. They don't really need to come here for those kinds of things. Technology can help us with that. We can also provide great support to many colleagues around our geography. We support hospitals across the whole of the North West, North Wales, and into the Midlands. And we can do that much more effectively by creating telemedicine links. The lovely Liz here from the North West Coast helped us to put this together, and that's Ram Kumar, who's a neurologist at Alder Hey, providing direct diagnosis into district general hospitals around our patch. Not possible without brilliant technology, because it's very scary to do a diagnosis on a patient when they're not in the room with you. You need really great technology to do that. I'm working with colleagues in Liverpool, in this case, John Moore's, to try and address that. Can you imagine how scary it is to be sitting there, and how scary it is as a parent to be looking at that? There's some great work going on in our universities. And one of the things that JMU are doing at the moment is thinking about patch technology. And patch technology is a way of putting a patch on the skin to understand exactly what's going on inside. This, for us, could mark the end of what we call the leech in the health service, the phlebotomists. One of the scariest things for children is having a needle stuck in them. And we have to stick needles in children to take blood from them. We could move on from that with technology. Funding. We're not very good at accessing different types of fund in the NHS. We're novices at it, actually. But it's really opened our eyes. And again, the work of the North West Coast working with us has opened our eyes to the vast array of opportunities there is out there to help. And we've worked with many partners who are now investing in Alder Hey to make these technologies and others a reality. And I said before, we started with BT. This was 18 months ago, 2 years ago. These are the partners with whom we have now signed Memorandum of Understanding to take forward new technologies in that new hospital and research centre that we'll be moving into in 2015. And I'll end where I started, with Ken and his challenge. What's the art of the possible? Truthfully, I don't know. What I do know is that children have no limits to their imagination. And what they've taught us is that we shouldn't either. So if we want to be one of the leading providers of healthcare and research for children in the world, we should make sure we stick to that principle that we continue to be inspired by children to deliver the very best we can. The art of the impossible. Thank you.